Blood circulates around the body to supply oxygen and nutrients. A sudden onset of hematologic disorder affecting blood cells can be life-threatening. Most blood disorder patients do not experience any noticeable symptoms in the early stages. But common signs and symptoms include proneness to fatigue, pale face, and dizziness. Also, if you are prone to bruising, frequent nosebleeds, bleeding in the gums when brushing your teeth, sudden fever or chills, then you should consult a doctor. A low white blood cell count and low platelet count can potentially lead to septicemia or cerebral hemorrhage. And the patient's life is dependent upon how fast it is detected and treated. Human blood is composed of a liquid component called plasma and cellular components, i.e. blood cells. Blood cells are divided into red blood cells, white blood cells, and platelets. These blood cells are formed in the bone marrow. The bone marrow is the spongy tissue inside the bones where stem cells differentiate and give rise to blood cells such as RBCs, WBCs, and platelets. Aplastic anemia is a condition in which the number of stem cells in the bone marrow decreases and new blood cells are produced. As a result, the number of RBCs, WBCs, and platelets in the blood gradually declines over time. When a blood disorder is suspected based on a blood test, bone marrow is collected from the hip bone for a test. Then the bone marrow aspiration and biopsy are conducted to determine bone marrow production capacity and the severity of the disease. A treatment plan is devised based on the severity of the disease and final diagnosis. Without proper treatment, 2/3 of patients with severe aplastic anemia will die within 6 months due to infection, bleeding, etc. Based on your bone marrow exam results showing celerity, it appears that there are not many cells in the blood marrow. Because of the decline in blood cells in the bone marrow, blood production cannot occur properly. RBCs, WBCs, and platelets are produced in the bone marrow, but because your bone marrow contains few blood cells, it is unable to produce blood, resulting in various symptoms. The lack of RBCs is causing anemia, the lack of WBCs is causing frequent infections, and the low platelet count is making you susceptible to bleeding and to bruising. In the case of hemoglobin concentration of 7G to DL or lower, or severe anemia, a red blood cell transfusion is necessary. If the platelet count is 10,000 or below, a platelet transfusion is necessary to prevent serious bleeding. What's even more important is that such patients will have a lower neutrophil count and be more susceptible to serious infections. Transfusions without treatment will result in excess iron and cause diabetes, heart failure, or other complications, and the patient will ultimately die from infection and septicemia. The most aggressive and fundamental treatment for aplastic anemia is allogenic hematopoietic stem cell transplantation. Generally, it is performed with the patient's sibling as the donor, but in a full match cannot be found. A donor may be found through a stem cell bank. If there aren't any donors, however, drug therapy using anti-thymocyte globulin or cyclosporin may be carried out to regulate the immune system. As for allogeneic HSCT, depending on the extent of which the human leukocyte allogens is called a full match or a half match, which means 4 out of 8 HLAs match. HSCT is divided into a match-related donor transplant, where the donor is a family member, and an unrelated donor transplant, where the donor is a non-family member. For HSCT, an anti-cancer agent and immunosuppressant are administered to the patient to clean the bone marrow and suppress the immune system. And then the normal hematopoietic stem cells collected from the donor are injected into the vein. After the transplant, the normal stem cells will proliferate in the patient's bone marrow and produce normal blood cells. The success rate of haploidentical HSCT has risen and is almost equivalent to that of unrelated donor transplant. Patients with severe aplastic anemia who didn't even have a chance of receiving HSCT due to compatibility are now eligible to receive HSCT with a family member as a donor. With the latest advancements, the success rate of HSCT with siblings as donors is 90 to 95%. And the success rate of unrelated donor transplant and haploidentical transplant is around 90%. Immune thrombocytopenia in the autoimmune system is where the immune system perceives platelets as foreign and attacks them. Platelets play the role of a bandage, allowing blood to clot, so that even when your blood vessels burst, the bleeding will stop quickly without bruising. Your blood test results show a platelet count of 17,000. That's a seriously low platelet count. Normal platelet count is around 150,000, but your platelet count is 17,000, which is why you are experiencing various symptoms. What you're experiencing, such as being prone to bruising, nosebleeds, and bleeding from the gums when brushing your teeth, are signs of low platelet count. You need to receive treatment as soon as possible, so we will begin drug therapy today. ITP patients have an extremely low platelet count, and the platelets cannot perform their roles properly. Even the slightest impact can lead to bruising, nosebleeds, and bleeding from the gums. Women experience frequent bleeding, including vaginal bleeding, and if it isn't treated properly, it can lead to cerebral hemorrhage, intestinal hemorrhage, etc. A step-by-step treatment plan is devised. Initially, drug therapy can improve the condition by 60 to 70%. If that fails, immunoglobulin therapy or splenectomy may be performed. If splenectomy doesn't work, there's a new drug covered by insurance that can increase the platelet count, and it's highly effective. Proximal nocturnal hemoglobinuria, which is a rare disorder, occurs when RBCs get destroyed in blood vessels. Affecting individuals will experience severe fatigue, anemia, abdominal pain, and dark brown urine due to the dead RBCs present. A major complication is thrombosis, which can occur anywhere in the body and is life-threatening, or aplasticanemia, or myelodysplastic syndrome due to the problem in the bone marrow. The flow cytometry results from your blood work show that there are RBCs without the necessary protective barrier. They make up 63% of all the RBCs in your case. What this means is that the protein membrane for protection is not being made. A Around 63% of the cells cannot make it. This is the root cause of the condition. Paroxysmal nocturnal hemoglobinuria is so dangerous that affected individuals are called a walking time bomb. The name is long, so it's referred to by its acronym PNH. In PNH patients, destruction of RBCs can lead to thrombosis, an obstruction in the blood vessels resulting in complications associated with the kidney, liver, brain, lung, or other major organ. Around 1/3 of all PNH patients die within 5 years of being diagnosed with this life-threatening disorder. It also causes severe fatigue regardless of the RBC count, which makes it difficult to work and carry out one's daily activities. The main treatment method is targeted therapy using eculizumab to block the attacks from the complement. The treatment alleviates the symptoms, making it possible for the patient to lead a normal life. We're currently conducting a clinical trial using a new drug for PNH. We're in phase 3, and it is the biggest prospective study involving more than 250 PNH patients from 25 countries. I, as the principal investigator, published the results of the phase 3 clinical trial in the leading hematology journal, Blood. Eculizumab therapy requires an injection every 2 weeks, but the new drug, revolizumab, only needs to be injected every 8 to 12 weeks. It effectively inhibits the destruction of RBCs, thereby mitigating all kinds of complications. So it is a revolutionary drug for treating PNH. When the new drug is approved, it will be more convenient for patients to receive treatment, and the treatment itself will be more effective. Dr. Lee, a leading authority in the field of aplasticanemia and bone marrow failure, has served as the first chairperson of the Aplasticanemia Research Society of the Korean Society of Hematology and the chairperson of the Korean Society of Blood and Marrow Transplantation. He is also engaging in the international academic activities as a standing committee member of the Asia-Pacific Blood and Marrow Transplantation Group. He has published over 300 papers in renowned international journals and contributed significantly to the development of hematology through research and education. The prolific medical specialist has published over 10 papers this year alone. And for imparting his knowledge of the advanced healthcare system of Korea to Mongolia. He was awarded the Order of the Polar Star and Order of the Minister of Health from the Mongolian government. He was also honored with the Distinguished Service Award from the American Society for Blood and Marrow Transplantation. I believe that I have 2 missions. First, I have a mission as a doctor. Second, I have a mission as a university professor. And I am constantly contemplating how I can fulfill these 2 roles and missions in the best possible way. As a doctor, it is my mission to save patients' lives and to cure as many patients as possible. Hematopoietic stem cell transplantation, HSCT, which requires donations out of love, is a type of treatment that is most aligned with the Catholic spirit and belief to save people's lives. Next, as a university professor, I believe tireless research is essential to cure as many patients as possible. So, in that respect, I plan on continuing my research activities until retirement. My ultimate wish and mission as a physician And Professor is to be a great role model for my students and young physicians. Professor Lee Jong-wook is touching the hearts of patients with blood disorders who have lost all hope. From HSCT to new drug development, his relentless research related to hematologic disorders has helped prolong the lives of many patients. In order to help patients lead a life of hope and carry out daily activities without pain and suffering, Dr. Lee is fully dedicating himself to research and treatment.